This is Stanley BERKE from Ophthalmic Consult of Long Island, and I would like to present the combined phaco and ECP procedure. Endolaser cyclophotocoagulation is the first and most frequently performed microinvasive glaucoma surgery. Phaco ECP has a long history of proven safety and efficacy. My partners and I have been performing phaco ECP since 1998, and since then have performed over 2,000 procedures. The typical patient has mild to moderate glaucoma and is on 2 or more medications. ECP is added to the phaco procedure in an effort to lower intraocular pressure and decrease the need for glaucoma medications. The surgeon performs phacoemulsification with intraocular lens implantation in the usual manner. Then a sodium hyaluronate viscoelastic is injected posterior to the iris and anterior to the lens capsule, allowing unobstructed access to the ciliary processes. The endo-optics laser endoscope is then inserted into the phaco incision. The surgeon will view the processes on the TV monitor, and the epithelium of each process is treated using continuous diode laser energy from top to bottom and in between, and the end result is shrinkage and whitening of the ciliary epithelium. I typically treat between 200 and 300 degrees of ciliary processes, but up to 360 degrees can be treated. There have been no reports of hypotony or ptysis with 360 degrees of phaco ECP. At the end of the case, the remaining viscoelastic is removed by irrigation and aspiration. No wound sutures are required. I suggest treating all patients with glaucoma drops and oral Diamox to prevent early post-op pressure spikes. On the left is the E2 unit by Endo-Optics with the video monitor on top and the surgeon's view of the endoscopic treatment in progress. On the right is a schematic showing treatment of the entire ciliary process from top to bottom and in between. Laser endoscopy permits visualization and photocoagulation of the ciliary processes in essentially any patient, despite the presence of corneal opacification, a myotic pupil, or previous glaucoma surgery. It provides the advantages of a direct view of ciliary process photocoagulation and avoids the complications associated with transscleral cyclodestructive procedures, which are typically used as a last resort. The endoscopic image will also reveal pathology such as pseudoexfoliation and zonular and capsular defects, as well as retained lens fragments. Other uses of the endoscope for the anterior segment surgeon may be limitless, including closure of a cyclodialysis cleft and goniotomy for congenital glaucoma. ECP is a simple procedure that only adds a few minutes to the phaco procedure. It's easy to do, it's titratable, it's repeatable, there's value added for patients. There's no additional patient visits, there's no long-term complications, the conjunctiva is left undisturbed, there are no early or late complications, it's reimbursable, and it is fun and interesting.